Hi everyone, Dr. Page here. Welcome back to another 5-minute stretching session. This is going to be pregnancy friendly for the most part, and this is going to be for our hip flexors and our IT bands. So follow along with me. All you need is a mat and a wall to start, okay? First stretch we're going to do is to open up that hip flexor, and this is a standing variation. You're going to grab onto the wall with my right hand in this case. My left leg is going to go behind me, and I'm in a bit of a staggered stance here. I'm going to sink my hip outwards away from the wall, and my upper hand is going to come up and over the top. I want you to really reach here, really think about driving this hip outwards away from the wall. This is a really nice way to stretch that hip flexor, and you don't have to get onto the floor to do this. You can do this anywhere, you can do this at work. Really reach up and above. You can even take both hands overhead and really sink into that wall if that feels nice to you. The nice thing about this stretch, it also helps with a little bit of round ligament. So mamas, if you're pregnant, that round ligament is right in through here. This will give you some nice stretch in through that ligament as well. Also in through the rib cage, in through a little bit of diaphragm, and maybe even some shoulder. If this is feeling good for you, I want you to stay here as long as feels good, okay? We're gonna breathe. Good. While we're here, we're gonna switch gears. We're now gonna switch the IT band, or stretch the IT band on the opposite side. So what I'm gonna have you do in this case is switch legs, shake out that left leg. Right leg's gonna go behind. Now I'm focused on my right side, which is closer to the wall, and I'm gonna drop into the wall, leaning my hip into that wall. So I am stretching my right side, my right IT band, lateral hip, this whole right side of my body. Again, lean in as much feels good to you. If you're a little bendier, you might have to go a little further. If you're pregnant, just make sure that you're going as far as feels good to you. I want you to breathe. I want you to focus on taking a few deep breaths, leaning into that wall, stretching out that side hip. If this is feeling good, I want you to stay here as long as works for you, okay? Beautiful. Okay, I'm gonna switch sides. So I'm gonna turn myself around, starting then with the opposite hip flexor, so my right side. This right leg is gonna go behind. I'm gonna hold onto the wall with my left arm, staggered stance. My right arm comes up and over, and I'm getting long through my side body. I'm stretching out that right hip flexor, that round ligament, diaphragm, a little bit of shoulder. Get all the way up, reach, 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 reach. Again, you can do this anywhere. I want you to be here for as long as feels good. If this is too much, back off a little bit. If it's not enough, we're gonna add on to this next stretch. Beautiful. Stay there if you feel better there, okay? Now, switching on gears, left side hip flexor, IT band. This leg's gonna come behind, left leg behind. Hip is now going into the wall, so my left hip is sinking down towards the wall. I'm now stretching the IT band, or my outside leg on my left side, sinking into that wall, getting some good stretch on the opposite leg, okay? Again, if this feels good, I want you to be here as long as it feels good to you. You might notice one side's tighter. A few more breaths here. Breathe in. And maybe as you breathe out, you sink a little deeper, find a little bit of a new position, and deepen that stretch, okay? Beautiful. Shake that out. We're gonna come down to the mat, okay? This is a similar idea, except we're gonna go onto the floor. So if your knees are bothering you, stick with the wall position. If not, come down to the floor with me. Right leg's gonna go up. Whatever leg is up is closer to the wall. I'm being supported. We're gonna keep our chest up nice and long. I'm gonna sink down into 90 degrees with my leg. This hand goes on my inner thigh. We're stretching this hip flexor on my left side, okay? Also round ligament, getting into that lower belly. Left hand goes on inner thigh, push yourself back, and bring your gaze over the other corner of the room, over your opposite shoulder. This should give you some good pull on this hip flexor. If this is bothering your knee, go back to the wall variation, okay? Sink, 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 breathe. As you breathe, drop further. Beautiful. If that's feeling good, stay there as long as you need, okay? I'm gonna switch sides. Now my left leg goes up against the wall. My chest is tall, I'm sinking down, my knee is at 90. Right hip is what we're stretching now. My right hand goes on my inner thigh. Push yourself back, bring your gaze over that shoulder. You can even, to deepen it, bring your arm overhead, just like we did standing. That will get more round ligament, more rib, more diaphragm, and shoulder, and sink into that stretch. Let that feel nice. Breathe in, and breathe out. Beautiful job. Okay, stand up, shake it out. That's all I have for you.